TikTok as a dancing app, but it has really grown way past that.
Now with more than a billion, is that right, billion?
More than a billion. Yep, that is right.
A billion. TikTok it is the go-to app for the latest trends.
Especially for young people. And some are pretty entertaining, but some are questionable.
Yes.
And we are joined by Dr. Laura Saunders from the Institute of Living because we're talking about the dangers of diagnosing disorders on TikTok. Welcome, Doctor.
Hello, friends, and happy Wednesday.
Happy Wednesday
to you as well. All right, so the kids are going on TikTok and self-diagnosing? What's happening?
So I was talking with a group of interns yesterday that I helped supervise, and they had commented that they are having more and more young people come to them saying, "Oh, I found this disorder called maladaptive daydreaming," or whatever they'd come up with, and I found it on TikTok. And we were all like, "Oh, well, that's really not very good." So what the concern is that young people are having some symptoms. I'm not saying they're not struggling with things, but they're having symptoms. They're looking for help, but they're looking in resources that are not reliable.
So this is the thing is you might and we do this with Dr. Google all the time too. I know it can frustrate our physicians, and you come in and you're like, "I think I have all of this," and like, "Yeah, no, you don't have this disorder." So what's happening is they're saying, "Okay, I forget things sometimes. I'm a little unfocused. Oh, I must have ADHD."
Right. And then what happens is once they do that, then they over-identify with the disorder, and everything that they think or feel or see is connected to that. When what I don't want for young people to do is to become a disorder. Even if someone has depression or if someone has anxiety, I don't want them to say, I am depression, or I'm bipolar, or I'm maladaptive daydreaming, or whatever it is. That I don't want young people to overly identify with their disorders. So finding ways to, get information. But if you're really struggling enough, you'd need a professional, because they'll look up symptoms and they'll not understand the severity of the symptom. They might have a symptom, but it might be mild in the scope of symptomatology.
Yeah, and you're saying, they have these self-assessment quizzes online and bite-sized definitions, which certainly aren't going to help anybody.
Right, they're not going to help anybody. And again, you don't have, certainly as a teen or a young adult, you don't have other pieces of information to fit into the puzzle. That's really what a professional is for. Yeah. So just because you check a box related to a symptom doesn't really assess the severity and functionality of that symptom.
And you bring up a point that there's also the algorithm. So once you say, okay, I have this disorder, and you start searching it, you just get tons of stuff in your feed about this. So you said the solution to that is not really to tell the kids you can never be on TikTok, but ask them to start searching for some positive things that will actually interrupt the feed. Maybe it's gratitude, maybe it's healthy eating, whatever, just something so you're not getting everything about a disorder that you may not even have.
Right, and so that's really the sickening part of some of the social media sites is this concept of an algorithm, right? Years ago, I didn't even know what an algorithm was, but these algorithms, what they do is they pick up keywords in any video that you're on for any period of time, right? So if you just go right past it, it doesn't pick up on the algorithm, but the algorithm then holds on to keywords, and then it sends you more and more little snippets of videos. And again, these videos are like on average of 30 seconds, so they're easy to digest from an attentional standpoint, but that just makes them like little worms in your brain. But you have to do things to actively change the algorithm. You have to look up other videos. You have to put in other hashtags. So doing things to change the algorithm, otherwise you are down a very serious wormhole.
What do you think about young people searching for community, and sometimes they use their struggle with mental health symptoms as a way to find like-minded people?
So I have frequently railed against social media. However, what you're bringing up there, Scott, is one of the positive aspects of social media, which is finding a sense of connection and community for those people that feel more isolated or more disconnected. However, I don't want online resources to be the only way that people feel a sense of connection, because otherwise we're losing our ability to do face-to-face and really have real-time interactions with people. But if it's a good starting point for people who feel disconnected or isolated.
Right, and just, we only have, 30 seconds left, but just the way we change our words. You don't want people saying, I am bipolar, but rather I have bipolar, I have autism. Rather treat it more like a symptom like we would for any other illness.
Diagnosis is a starting point. It's not an end point. And I don't want people to over-identify with a diagnosis. It's a piece of information, and from that piece of information, there's a lot of other things that we can do to prescribe treatment or other recommendations.
All right. Thanks, Dr. Laura Saunders. We appreciate your help.
Have a great day.